All right, y'all, here we go. Question number 11, point blank, period. Nurse Patricia is aware that the average length of time for HIV infection to develop to or of AIDS syndrome. What? How long does it take for HIV to become AIDS? There you go. Less than 5 years, 5 to 7 years, 10 years, more than 10 years. What are we thinking? And the answer is C. It is 10 years. Epidemiology, right? Studies show that the average time from initial contact with HIV to develop into AIDS is 10 years. The interval from HIV infection to diagnosis of AIDS ranges from 9 months to 20 years or longer, with a median of 10 years. That is physiological adaptation, which is the third largest section on the NCLEX exam. Question number 12, an 18-year-old male client admitted with heat stroke to show signs of disseminated intravascular coagulation, DIC. Which of the following laboratory findings is most consistent with DIC? All right. Is it low platelet count, elevated fibrinogen levels? Is it low levels of fibrin degradation products, or is it reduced prothrombin time? Here we go. And the answer is A. It is low platelet count. And DIC, platelets and clotting factors are consumed, resulting in microthrombi and excessive bleeding. As clots form, fibrinogen levels decrease and the prothrombin time increases. That is reduction of risk potential, 9 to 15% on the NCLEX. That is the fourth largest section on the NCLEX exam. All right. Management of care. Management of care, pharmacology, physiological adaptation, reduction of risk potential make up more than half of the exam. All right. Question number 13. Mario comes to the clinic complaining of fever, drenched night sweats, and unexplained weight loss over the past 3 months. Physical examination reveals a single enlarged supraclavicular lymph node. Which of the following is the most probable diagnosis? Is it influenza, sickle cell anemia, leukemia, or Hodgkin's disease? What are we thinking? And the answer is D. It is Hodgkin's disease. Hodgkin's disease typically causes fever, night sweats, weight loss, and lymph node enlargement. Part of physiological adaptation, 11 to 17%. Third largest section on the NCLEX exam. E.A. Green in California. All right. So, hey, when you get it wrong, because trust me, you will not get all of these questions right. The NCLEX, if you start getting all these questions right, the NCLEX is going to start giving you really hard questions. And that is the goal. The goal is to get to the hard questions, ladies and gentlemen. That is the goal. So you're not meant to get 100% on the NCLEX because that's not a thing. All right. Not even trying to be a nurse. Cool. As long as you're here rocking with us, that's cool. So hey, look, the goal is to get to the hard questions. All right. Shout out to Ghana. Anyways, question 14. A male client with a gunshot wound requires an emergency blood transfusion. His blood type is AB negative. Which blood type would be the safest for him to receive? Is it AB RH positive, ARH positive, ARH negative, or ORH positive? What are we thinking? And the answer is C. I was about to say A, but the answer is C. It is ARH negative. All right. So human blood can sometimes contain an inherited D antigen. Persons with the D antigen have RH positive blood type. Those lacking the antigen have RH negative blood. It's important that a person with RH negative blood receive RH negative blood. That is part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. If you love to hate, you hate. Facts. Let them know. Hey, so shout out to everybody that got that question right. You guys already know the deal. Circle back if you got it wrong. By the way, something I do want to state is that if you're if you're an LPN going to take your PN exam, you learn the same exact content that the RN learns. You just need to know what you can and cannot do and what you can and cannot accept. Right? You know that you can't do initial teaching, LPN. You know that you cannot do IV medications. You can't do blood transfusions. It doesn't matter what your state says because the NCLEX is a national exam. Okay. So You need to know what you can and can't do, what you can and cannot accept. Shout out to you, Sherry. Is it Sherry from Australia? Question 15. Stacy was diagnosed with acute lymphoid leukemia. She was discharged from the hospital following her chemotherapy treatments. Which statement of Stacy's mother indicates that she understands when she will contact a physician? I should contact the physician if Stacy has difficulty in sleeping. I will call my doctor if Stacy has persistent vomiting and diarrhea. My physician should be called if Stacy is irritable and unhappy. Should Stacy have continued hair loss, I need to call the doctor. What are we thinking? The answer is B. I will call my doctor if Stacy has persistent vomiting and diarrhea. Persistent, meaning more than 24 hours of vomiting. Anorexia and diarrhea are signs of toxicity, and the patient should stop the medication and notify the healthcare provider. That is part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. And think about it. Somebody who's going to have persistent vomiting and diarrhea are going to have an electrolyte imbalance, right? Think about that potassium, right? Think about my heart, think about dehydration, think about all that stuff. That's where you have to think to yourself. That's where you have to put your critical thinking into place. All right. In order for you to make a clinical judgment. Retired forensic nurse here. Any others? No, Mama Beans, I think you're alone on that one. But shout out to you being forensics. I know one other person that does forensics, and I know that they love it. Critical thinking is hard. It's not hard if you do it every day. You know what I'm saying?